Good afternoon, all. Myself, Dr. Imran Ali, MD Physician, SDS Hospital, Fatehpur, Sikar. Today, we are discussing about the topic of pedal edema and CKD, both symptoms and treatment. First, we see what pedal edema is. Pedal edema is a condition where extra fluid accumulates in the lower leg and feet, causing them to swell. This swelling happens for several reasons such as heart problems, liver problem, thyroid, kidney problems, blood clots. Our body fluid are divided into two main areas, or inside our cells and outside of them. The outside area includes space around our cells inside our blood vessels. The outside area includes the space around the cells inside our blood vessels. Edema or swellings occurs. There is a problem with how fluid are distributed between these areas. This problem can happen if too much pressures build up in the blood vessels, often due to heart issue, excess fluid. It can also occur if there are not enough proteins in the blood like albumin, which keep fluid in the vessels. Additionally, the lymphatic systems normally helps move extra fluid and protein back into the blood, but this system is not working properly. Fluid can build up and cause swellings. The kidney play a crucial role in the regulating the blood fluids balance. The kidney helps remove waste and regulate fluid. When they are not functioning properly, fluid can accumulate, leading to edema, as seen in CKD, AKI, nephrotic syndrome. Edema is one of the major symptoms of CKD. Let's explore how clinicians approach the diagnosis of edema. First, a detailed history helps identify risk factors, underlying conditions like heart failure, kidney disease, or thyroid disorders. Edema can be generalized or localized. Generalized edema, this type affect the entire body or large area and is often linked to conditions such as heart failure and kidney failures. Localized edema, this type causes swelling in just one area of the body. It's often due to inflammation, blocked lymph node fluids, and issues with blood flow in the veins. During a physical examination, clinician looks for pitting edema, indentation after pressures, including heart failure or nephrotic syndrome. Non-pitting edema suggests lymphatic obstruction or hypothyroidism. In case of bare renal disease, the following lab tests are imaging are helpful: CBC, renal function test, including serum creatinine, urine analysis, urine microalbuminuria, and urine albumin to creatinine ratio, as well as ultrasound of the abdomen and pelvis. A thorough history and physical examination are key. Identify systemic cause and specific sign guide the management plan. When it comes to managing edema, the approach depends on whether the cause is local or systemic. For local causes, non-pharmacological treatment are essentials alongside addressing the underlying issue. The systemic cause, a combination of generalized measures and targeted treatment is needed. For the local edema, non-pharmacological measures are include limb elevation. Regularly elevating the affected limb help the reduce swelling. Compression therapy, wearing compression stocking can assist in improving the blood flow, improving the blood flow. Physiotherapy, massage, and other physical therapies should be performed by the trained professionals. Ice applications useful for severe and congested edema and cases of cellulitis. In cases where systemic cause are play a such a in CKD treatment focus on reducing fluid retention and addressing the underlying condition. This improve salt restriction. Limiting salt intake help prevent fluid buildup and manage volume overload. Diuretics. These medicines are increase the urine output to help manage fluid levels. Different type of include loop diuretics, thiazide diuretics, and potassium sparing diuretics. Loop diuretics include furosemide, torsemide, often performed for their effectiveness and longer duration of action. Thiazide diuretics like metalazone used adjunctively for their enhanced diuretic effect. Potassium-sparing diuretics like spironolactone used cautiously due to potential risk of hyperkalemia. The choice and the dose of diuretics depends on factors like the severity of the edema, the patient's hemodynamic status, kidney function. It is important to use the diuretics cautiously to avoid complications like hypokalemia, hypotension, electrolyte imbalance, regular monitoring of fluid volume and urine output, blood pressure, weight, and periodic test is essential. The choice and the dose of diuretic depend on the factor like severity of edema, the patient hemodynamic status, kidney functions. It is important to use diuretics cautiously to avoid complications like hypokalemia, hypotension, electrolyte imbalance, regular monitoring of fluid volume, urine output, blood pressure, weight, and periodic test is essential. In CKD, managing edema often requires salt and fluid restrictions, high diuretic dose, loop diuretics like furosemide use effective, but thiazide diuretics can be added. Managing edema improve a tailored approach for local edema. Non-pharmacological methods like are key and systemic causes are required. Dietary adjustments, diuretic and close monitoring. Patient education is crucial. Understanding the condition following the treatment plan, making lifestyle changes, improve outcome, early recognition and effective symptom management help prevent complications. Thank you. Thank you so much.